Are there specific assessment tools or tests used to evaluate PDA in adults? Are you curious about how professionals assess pathological demand avoidance in adults? This is an important topic, especially for those navigating autism spectrum disorder. While pathological demand avoidance is not officially recognized as a separate diagnosis in the Diagnostic and Statistical Manual of Mental Disorders, there are specific tools designed to evaluate its traits in adults. One of the primary tools used is the Extreme Demand Avoidance Questionnaire for adults. This questionnaire consists of 26 statements and takes about 10 to 15 minutes to complete. It is intended for adults aged 18 and older who have average or above average intelligence. The questionnaire measures behaviors associated with extreme demand avoidance, such as avoiding routine demands and experiencing emotional variability. The Extreme Demand Avoidance Questionnaire for adults was developed based on clinical observations and research into pathological demand avoidance traits. It has shown reliability and consistency when compared to peer ratings. However, it is important to note that this tool is primarily a screening instrument rather than a diagnostic one. Professionals often use the Extreme Demand Avoidance Questionnaire for adults alongside detailed patient histories and clinical observations. They may ask questions about childhood experiences to gain a comprehensive view of an individual's behaviors and challenges related to pathological demand avoidance. Since pathological demand avoidance overlaps with traits of autism spectrum disorder, assessments usually consider the broader autism profile. This includes evaluating personality and emotional regulation factors. The relationship between pathological demand avoidance and autism spectrum disorder traits can be complex. Sometimes, behaviors associated with pathological demand avoidance are more closely linked to emotional distress and behavioral regulation than to core autism features. In practical terms, assessing pathological demand avoidance in adults involves several steps. First, the Extreme Demand Avoidance Questionnaire for adults is used as a self-report screening tool to identify demand avoidance traits. Next, professionals gather detailed developmental and behavioral histories, including childhood experiences. Clinical observations and interviews help to understand the individual's emotional responses and coping strategies. It is also essential to consider pathological demand avoidance within the wider context of autism and neurodiversity. This approach allows for a better understanding of the individual's needs and supports tailored management strategies. These strategies can address the need for control, anxiety, and safety-seeking behaviors that are typical of pathological demand avoidance. While no single test definitively diagnoses pathological demand avoidance in adults, the Extreme Demand Avoidance Questionnaire for adults is the most recognized tool available. It is used alongside comprehensive clinical evaluations within the autism framework to provide a clearer picture of an individual's experiences and challenges.